Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like. July 1st is a very exciting day. It's when I welcome our new interns, residents, and fellows.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Let's go.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom. This could be my dad. This could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, but equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hello everyone, my name is Peter Conti. I'm the founding director of the Molecular Imaging Center here at USC. The history of the molecular imaging program actually starts in 1991 with the installation of the first PET center and cyclotron facility here at USC. The PET center was one of the first clinical PET centers in the United States, and therefore we have a rich history of many years' experience in terms of clinical practice as well as training fellows and residents in the field. Right now we have 5 faculty and 1 adjunct that are available to perform a lot of the training exercises and experience for the residents and fellows. In total, our faculty probably have over 100 years experience in teaching and training in the area of PET. So in our area of nuclear medicine and PET, our residents and fellows spend different amounts of time depending upon what training program they're in, whether it's in nuclear medicine, radiology residency, or actual fellowship. So that time period can span from 1 to 2 years in general. Most of these programs allow for rotation between the specialties in nuclear medicine as well as PET. So in addition to getting training in PET CT, you're also receiving traditional nuclear medicine training at the Norris Hospital, at the Keck Hospital, and at the LA County Hospital. The training program allows for a vast array of different clinical populations. So while we see both pediatrics and adults, we see many different types of disease processes. So there's a blend of cardiology, oncology, and neurology opportunities in terms of training, as well as an array of new radio tracers that we use in our field to explore brain function, cardio function, and traditional oncology studies. Most of our trainees get to experience not only the traditional clinical protocols, but participate in actual IND or investigational new drug studies with novel radio tracers that are being developed both here at USC as well as commercialized from other sources. We also offer preclinical opportunities for research activities. Residents and trainees or fellows can also participate in basic science, development of new diagnostic tools and new procedures, and it spans from doing novel radiochemistry experiments to preclinical studies in animal models, all the way up to, again, these early phase clinical trials.
Well, hello everyone. We're going to take a virtual tour of our Cyclotron Gmp facility as well as our preclinical imaging facility here at USC. This is a great opportunity for residents and fellows to take advantage of the research resources that we have in order to conduct either basic science, preclinical, or clinical research using the facilities here. So let's take a walk through. So we're in the control room for the Cyclotron facility, and what you just saw were some of our environmental monitoring systems that we control the humidity, temperature, airflow throughout the facility. And to your left here, you can see the beginning of the GMP facility. We're not going to go inside directly, but this is where we manufacture the radiopharmaceuticals for human use. And these are all stainless steel hot cells, as we call them, and inside are the production units for the radiopharmaceuticals that we use for human practice. We're going to walk through the facility into the quality assurance area, quality control area, in just a moment. Just as an aside, all our workers will gown appropriately here before entering the GMP facility, and this is a typical pharmaceutical, radiopharmaceutical type setup. So we'll walk through now the Gmp Qc area. In this facility, we have all the analytical equipment to test the radiopharmaceuticals for human use. Things like gas chromatography, high pressure liquid chromatography, and other tests that we perform here to ensure that the radiopharmaceuticals meet the appropriate criteria for administration into patients. So you can see the array of different analytical equipment that's in here, and the specialized hoods for us to do the testing that's required for release of these products for human use. In the back here, we have a couple of interesting pieces of equipment. Over here, we have what's called a pneumatic tube system. So this allows us to take a finalized dose for the patient produced in this facility and send it through a chute, essentially. Many of you have gone to Costco or other stores where they send the money up a chute, This is exactly what happens here with the dose. The canister contains the radiopharmaceutical, and it gets delivered right to the clinic automatically. We transfer materials back and forth through these pass-through chambers. So if you take a look through this little window here, you could see the other side of that GMP facility. When the product is done there, it's passed through into the QC room for testing. We also have a research laboratory here where early production for human use material, we can do the same thing and pass the doses through and do the quality control here in the facility. Again, once it passes all the QC tests, we can release it for human use. Or if it's going to go to animal use, we can transfer it next door to our imaging facility. So in this room, we house all of our basic material to make the actual drug products. So a lot of our injection solutions, a lot of our precursors that we use in the chemistry boxes and production systems are stored here in inventory. And this is very typical for a pharmaceutical type operation. Everything is checked in, quarantined, and then used with expiration dates logged and then discarded if things expire. And then we can move through these logbooks and follow the inventory as we proceed through the various months of production. This is a classical distribution of quarantine material that we would use for human use production. So I showed you some of the GMP facility earlier with those very beautiful stainless steel hot cells where we make the radiopharmaceuticals, but I wanted to show you the behind the scenes side of those hot cells. And the reason is because the amount of lead and other systems in here to protect the workers, but also the electronics and all the plumbing that's necessary to move that radioactive material through the various steps in producing the radiopharmaceuticals for human use. We also have a number of devices here to ensure that the material remains stable in an earthquake, because we are, of course, in Southern California. So the state had to make sure that we had the proper outfitting for the facility. But I just want to give you a sense of the complexity of the electronics and the various components that make the system run. I'm going to give you a little bit of a close-up of one of the hot cells. This is not in the GMP lab, but is very similar to the devices that we have in the GMP facility. And it'll allow you to see what's inside of those hot cells. So if we come on over here, you can get a little bit of a close-up. This is a chemical processing unit that's behind these leaded stainless steel doors. And all of this, again, is controlled automatically by the laptop computer, which is just next to the hot cell here. So as we process the radiopharmaceuticals, everything is, again, controlled electronically, and then we could transfer this material to the quality assurance laboratory that we saw earlier for final processing and check. So what you see behind me is the actual cyclotron. It's enclosed within this concrete vault, if you will. And inside there is a machine that actually accelerates charged particles. And those charged particles are what interact with various substances that we put in the cyclotron to make radioactive materials. So for example, to make fluorine-18, which is the most commonly used PET radio isotope, to make FDG, for example, for cancer imaging, we would produce the fluorine-18 inside this cyclotron and then transport the material from this cyclotron into that GMP facility that I mentioned to you earlier to make the final product. So now we're in the imaging suite. We have an array of different types of technologies in here where we're looking at small animals in general. Okay? And so some of the tracers that we produce in the GMP facility in our chemistry labs, we can do what we call PET studies on animals in here, micro PET studies. And we can also do optical imaging, MRI, ultrasound, photoacoustics, and X-ray imaging here. So the nice thing about small animal imaging is that we can serially image the animals just like we do for patients. So if the animals are on a protocol, let's say you're treating the cancer, you can actually scan them serially over weeks or months without actually putting them down and keeping them alive and watching the full course of the trial, if you will, by studying them with this type of technology. So the animals have, and you can see in the background, we have an array of technology here for anesthesia and Survival for the animals. So they're treated, they're caged in their natural housing, they come here for imaging. When they come here, they get anesthetized, go on the scanner, they recover, and then they go back home to their cages. And they're, again, followed as if they're on a clinical trial. This is photoacoustic ultrasound imaging. So here you can see a live photoacoustic scan showing you motion in the organ system. And this is done, again, in small animals. You can see how the table for the small animal, the probe that we can use, to measure whatever parameter we're looking at in the animal, whether it's tumor size or we're looking at the normal organs. But it's treated just like a patient, but on a much smaller scale. So this is an example of an X-ray producing device. We can actually take X-rays of our animals. And on the screen here, you can actually see an example of the spine and pelvis in a mouse, little tiny vertebral bodies. And this is an experimental protocol where we're actually using scaffolds to rebuild bone. And we can track these animals over time and see how bone growth occurs on that scaffold. Next to it is a micro-PET, compact micro-PET scanner. Again, you can see the small configuration for animal use. And then finally, we have an optical imaging system here and some examples of an optical scan shown here. This is an example of a brain tumor model showing you the optical signal from those cancer cells that are expressing that fluorescent probe, so we can pick up that signal on the optical scan. And you can see the overlay on top of the picture of the animal inside. So this is one of the first micro-PET scanners in the country. This is the old R4 Rodent Scanner. It's a few years old, not quite as old as I am, but a few years old. But you can see it is essentially a miniature version of today's PET scanners. Okay, it's a small bed, small bore, and so we can scan mice and rats, and very small chimpanzees in this type of device. But again, very old technology, but still functioning. Next to it, we have a MRI system. So again, we can do anatomical imaging. This is an aspect MRI. It is a low field unit, but allows us to get very nice anatomical information, which we can co-register with information that we might get on a PET scanner. So we can fuse the metabolic information from the PET and the anatomical information from an MR or a CT scanner by capitalizing on this device. Over here, we have what is actually a PET-CT device, very similar to the clinical PET-CT device that we use for patients. On the left-hand side is the CT scanner, and on the right side is the micro-PET scanner. So in this room, I'm going to show you some technologies that are CT or X-ray based, and this is for imaging in the nanometer range. So we're talking about very high resolution imaging. This is non-live imaging, so it's used mainly for specimens, and these could be biological specimens, they can be material science investigations, they could be for fossils. So there's a spectrum of things that we can do with this high resolution CT capabilities. And inside here is one of our devices. You can see the photo tube produces the X-ray device, and it would be, of course, aimed at the particular unit. So we're imaging specimens that could be very, very tiny in size, but we're getting ultra high resolution of that. So for example, the type of application you might want to consider would be in dental research, where we're looking at the very fine details of the architecture of the dental enamel, or in bones, looking at bone density and bone structure. In terms of things like fossils and material sciences, we're again very high resolution, looking at the fine details of the network of interconnections of the structures of these molecules using the CT technology. And again, we have an array of different devices. Many of these devices were procured through the NIH Instrumentation Fund through collaborative research efforts by investigators here at USC. And this facility, in a sense, is unique because we don't have this type of technology readily available. So we are one of the few places on the West Coast, in fact, outside of the national laboratories that can provide these types of imaging capabilities.
The founding of the facility occurred in 1991 when I arrived at USC. And the reason I've stayed all these years is the exciting opportunities that we've been able to participate in, not only for me personally, but for the various number of the trainees that have come through the program over these many, many years. I was recruited here from my training program at Johns Hopkins in 1991. It was the opportunity of a lifetime for me because it was a brand new modality. PET had not been in clinical practice to any extent at that point. And so USC had the insight at that point to think, well, this is an opportunity for introducing a new technology. There's really high levels of opportunities in terms of cancer patient imaging, cardiovascular imaging, and brain imaging. This is a novel approach. We can really move the needle, if we will, in terms of patient care. So they decided by investing in this technology back in those days that it would give a new breath of fresh air to the overall imaging program here at USC. The issue of being able to perform these investigational drugs is dependent upon having the cyclotron, having the preclinical imaging space, because it's very difficult to take new technology from bench to bedside without having the proper tools in place to do this. And this is a great opportunity for residents and trainees to see how that is done and participate in that process. All of our trainees have found jobs, which is an important consideration for most people selecting a training program. So whether they're in clinical practice or in academics, the opportunities here allow that trainee to explore all of those options while they're in their training programs and then decide what is the best for them in terms of their career choices. And our faculty are there to encourage whichever pathway they seek and also provide the support for getting those jobs.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.